All right, let's talk some news. Jeff, here's a story you might find interesting, and maybe you can provide a counterpoint. So I saw there was a study that was released out of the Journal of Stomatology, Oral and Maxillofacial Surgery. They took patients with TMJ, degenerative disease, and did an injection of a bone marrow aspirate concentrate into the space. And after 1 year, they had repair that held versus traditional therapies like hyaluronic acid, which had a rate that, it definitely had a rebound rate to it. So anyway, I thought that was interesting. What do you think?
Very interesting. Obviously, there's going to be growth factor, bone morphogenic protein. So it's not surprising that there's going to be some healing in there. But, again, it boils down to what is the disc condyle relationship. If that disc is still too far away and we still have a bone on bone, even though, we may get some regenerative effect, we're not really growing new disc where it's not happening. So, I think what we'll end up seeing is that while it may be as good as any other temporary measure to alleviate pain, I'd be very surprised if we saw long-term results with that. Now, that in combination with maybe some repositioning, or that in combination with some non-invasive surgery or other techniques, I think we'll really see the benefit.
Well, and I always like moving towards therapies that are autogenous.
Absolutely.
As opposed to putting cortisone in there or, some other type of destructive or
100%.
Artificial.
Couldn't agree with you more.
So I like where that direction is headed. And I love the idea because, too, there are patients that want palliative care and there are patients that want treatment. And so it is nice to have tools in the toolbox to maybe be able to provide healthy options. Because I do know if you keep injecting, I don't think many folks are doing this for the TMJ space, but if you keep injecting, cortisone in those spaces over and over again, by the time you get in there to actually do the treatment, you're going to have a fair amount of damage as a result of those injections.
A lot of damage as a result.
So, I like the idea of that.
Yeah, there's really in the TMJ world, there's not really many people who advocate the use of steroids. And the other problem with it is there are very few people who can actually find the superior intracapsular space. So, they don't even know where they're putting it a lot of times. So
exactly.
Bad
All
thing.
right. So how about this? Suboxone, which is a medication that's been on the market since 2002 to treat opioid addiction. So a lot of folks that found themselves addicted to pain medications were prescribed this medication as an alternative to sort of get the body to reset and move away from the opioid addiction. Well, in 2009, we'll say somewhere around that time period, they came out with an alternative option of a sublingual or kind of a dissolving tablet film that you can take for quick intravascular absorption. Well, the adverse effect of that has been significant tooth and dental disease as a result. And so now there are over 300 reported cases with the FDA. The FDA has moved forward with a warning label for that classification of drugs. Now Suboxone is being sued, and the manufacturers of the medication are under a lawsuit now from a patient who experienced severe dental disease as a result of the medication. At that time, there were no warnings on the medication that could be an intended side effect. And what I thought was really interesting in the article is they actually cited that they had seen cases that it occurred as early as 2 weeks into the use of the product. So that's a pretty rapid onset. And you certainly could then argue that likely that disease process was not present prior if the onset was really that quickly after the move to the film dispensing type of Suboxone. So interesting. If you have patients that are on that medication and are receiving it through the film, or dissolvable tablet form. Certainly maybe a conversation like bisphosphonates that we need to be having to give them a heads up on the risk factors associated with that drug, because it is a new warning label attached to it. I think everyone saw this week that Smile Direct Club filed bankruptcy. I believe it was Chapter 11. Of course, this is a restructuring. It's not what everyone would like to see yet, but it definitely is a restructuring of finances and a strategic move to clean the slate a bit so that they can move some debt around. So the company has no indication of shutting down anytime soon. In fact, the founders have given it a $20 million capital injection to hold it over while it's in the bankruptcy period, to make sure that it continues to service the patients that it has and the 110 locations throughout the U.S. of scanning centers that they have for folks to do at-home orthodontics. So that is that. What will come of it, you never really know. And
Let's
of course,
just see what the legal world has to say,
yeah,
because I myself have witnessed many cases that have ended up with legal action, and absolutely with cause.
yeah,
So
absolutely.
yeah.
And then you saw Mitch Rubenstein posted last night or this morning, and I had seen the news article. Actually, Brian sent it to me earlier yesterday as well. That Tom Hanks is firing off a pretty
Mhm.
strong warning against AI generated marketing schemes. And in particular, he was used in AI generation for the marketing of a dental plan, which he did not participate in nor do the audio or recording for. But it is pretty darn believable and kind of scary. So, what that means for the future of marketing and what can you believe and what can you not believe? This is real. I'm here telling you this crappy news every week. And when it gets really, really good, then you should probably get suspicious it may be AI generated. Last news story for the night, a new scam alert out for medical providers. There are scammers calling medical provider offices stating that they are looking for the doctor either because they missed a court date, which is a pretty common one that we hear of, but more concerning, they're calling stating that they're calling from the local police department because they have information to believe that your DEA number is being used in drug trafficking cases in your area. And so obviously any dentist or medical provider would be really concerned to think that their DEA number had been compromised in that way. And I think on top of it, the scammers are using pretty detailed information. They're definitely doing their homework before they call to make it believe and sound like a very true story. So, always a good warning to give your front desk a heads up, not to panic, which they like to do from time to time. That when those calls come in, take a step back. The FDA or the DEA and the Federal Trade Commission have also encouraged folks to call them directly if you think something may be awry, because that would not be their usual mode of operation to reach out to you that way. I will tell you, as a side note, I had a staff member get called and say that her husband was kidnapped and that she needed to go withdraw money. And I mean, what a terrible situation, because she suspected that it wasn't real. But then how do you know that it's, do you know what I mean? She felt super stuck because they were incredibly intimidating and scary. She was unsure if her husband wouldn't answer his phone. So she was sort of very much stuck. Anyway, it was kind of a heartbreaking story. He's obviously fine and was not kidnapped. So anyway, they're definitely out there doing their work.